One last question that I'd like to ask Dr. Chambers. If you use the dry chamber to select for patients with a certain subset of characteristics of dry eye disease, what effect will this have on the labeling language for the indication that the drug is approved for?
The typical term that's used for that type of trial is an enrichment trial. You basically are enriching the ultimate trial for for more severe cases, and to the extent that that's the only criteria that you're using to control it, it's likely to have minimal effect on the label, because all you're doing is you're just pulling the more severe cases, the ones that are likely to respond. But if you do it equally between groups, you may not necessarily affect the label at all.
We're rapidly running out of time. I think I've covered most of the questions that have been submitted to me and through the group, and I want to thank you all for passing those along. I hope some of them answered your questions directly. I'd also like to thank Dr. Wiley Chambers, Dr. Mark Abelson, Dr. Steve Flugfelder, and Mr. George Usler for their participation. And I'll look forward to the next session in which we hear a slightly different slant on dry eye products. And we'll conclude this session now. Thank you very much.